For now, anyway, there's not a pill that works great at alleviating tinnitus or a procedure that works great at alleviating tinnitus, but there are other approaches that can certainly be helpful. There's the stem cell approach, and then there's various kinds of like small molecule medicines that are attempted to be delivered to the inner ear. And all of those avenues are being explored by different companies. In truth, there are a number of treatment strategies that have been shown in clinical research studies to reduce the severity of tinnitus. They're just not simple. They're just not quick fix solutions. And so they're not readily available to a person's primary care doctor. And some people may not be aware of what those treatment options are.
I'm joined today by my colleague, Dr. Brian Warden. He's an ENT doctor with a strong focus on helping tinnitus patients for over 15 years. I first met Dr. Warden at the National ENT Doctor Conference in Philadelphia, where we both attended a tinnitus update session. He completed medical school at UCSF Medical Center in San Francisco and his residency as an ENT physician at Stanford. I live in the Bay Area myself. Those are highly respected institutions. So today we're going to dive into tinnitus, the science, and how that can be brought into the patient treatment to help you guys find relief and ultimately reduce this noise and get back to living a fulfilling, normal life. Hey, tinnitus community, it's Dr. Ben with Treble Health. I have some big news. We opened 2 physical locations, California and Florida. Specifically, San Francisco, California, the Bay Area, and just outside of Fort Lauderdale, Florida, in a town called Weston. That's accessible from Miami, Fort Lauderdale, Boca Raton, West Palm Beach, and Naples. So if you are in these areas and you know someone who has tinnitus and needs help for that, absolutely check out the links below where you can schedule a free consultation at these clinics. This is a big move for us, and it's all possible because our YouTube community has spread this message that there is treatment, there is hope for people with tinnitus. I love what I'm doing, and thank you so much for the support. Please check the link below if you know anyone who could benefit from speaking to a doctor at a Treble Health tinnitus clinic today. Now back to the video. Dr. Warden, thanks for being here. My first question is, let's discuss the current state of research on hair cell regeneration. I'm genuinely curious. What are your thoughts on this? Could this help someone with tinnitus, and where are we at?
Yeah, well, first of all, Ben, thanks for having me on the podcast. It's always a pleasure to have a conversation with you. With regard to stem cells and inner ear regenerative therapies, it's a really exciting field, and it's fun to follow what's going on in that field. I think that it's something that holds real promise. And if you break down the different treatment approaches with regard to regenerative therapies for hearing loss and tinnitus, there's the gene therapy approach, there's the stem cell approach, and then there's various kinds of like small molecule medicines that are attempted to be delivered to the inner ear. And all of those avenues are being explored by different companies. And most of this work is being done in the private sector as opposed to being done at universities and whatnot, because there's promise that an effective therapy could help a lot of people and be successful for the companies that are developing them.
Yeah, I want to talk about specifically why hair cells are related to tinnitus. And for those of you guys listening later on, we're going to touch on the migraine-tinnitus link, bimodal stimulation, and other topics. So hang on there. But let's go into hair cell regeneration. So I have a helpful analogy that I want to introduce. The hearing system is similar to a PA system where you have a microphone, a cable, and then a speaker. So the microphone is where sound is picked up. And that's very similar to these small hair cells in the cochlea of the hearing organ. The auditory nerve is like the cable going to the auditory brain. And then the speaker of what plays sound, or so people can hear it, that's our auditory brain and how we process it. So for someone who has a hearing loss, it's most commonly the cells in the cochlea, these outer hair cells. They're not actual hair, but they're just very small microscopic cells that look like individual hair follicles and they vibrate. When someone has a hearing loss, meaning those cells decrease in function, then someone can develop tinnitus or potentially hearing loss as well. So we're looking at, okay, if we try to restore the cell function there, what impact would it have on tinnitus and hearing loss? I'd love to hear your perspective as an ENT physician, counseling many patients over the years, doing surgeries. What are your thoughts on the relationship there for someone with tinnitus?
Yeah, I mean, I agree with your analogy. When it comes to hearing loss, it can be damage to the hair cells in the inner ear, the inner hair cells or the outer hair cells, or it can be damage to the neurons there in the inner ear, the spiral ganglion neurons. Either of those can cause hearing loss. And the thought is, and nobody knows this for sure, but the thought is that most people with tinnitus have some degree of hearing loss, and that the tinnitus began as a side effect of natural compensatory mechanisms that happen in our brain in response to the decreased stimulation because of hearing loss. And then some maladaptive neuroplastic changes occur in the brain that allow the tinnitus to persist. So the hope is in this field is that if you can fix the hearing loss, that you might be able to actually undo some of those neuroplastic changes in the brain that were responsible for the tinnitus. That's the hope anyway.
Yeah, and with the hair cell regeneration for patients with tinnitus, one thing I see, a word of caution, is that patients think, oh, if this hair cell function returns, then my tinnitus will go away. However, we have some experiences of treating hearing loss where someone notices, no, even with well-fit hearing aids, I'm still struggling with tinnitus. What are your thoughts on that? Other than hearing loss, how much of someone's tinnitus could be related to other health systems?
Yeah, well, I mean, I would say that there's a difference between using a hearing aid to amplify sounds coming into the ear and actually restoring the hearing function by regenerating hair cells or regenerating the spiral ganglion neurons. But nobody knows for sure. But the hope is that if you actually restore real hearing, not just using a hearing aid, which is an amplification device, that would actually change how things are connected in the auditory pathways and be much more successful than something like hearing aids at alleviating the tinnitus.
And one comment I have is that for patients who do have a hearing loss, we know that sometimes treating the hearing loss is the low-hanging fruit in getting relief from tinnitus. So some element of the theory here can apply today. For example, if someone has a high-pitched hearing loss, maybe it's mild or moderate, they say, hey, I have a tinnitus problem, but I don't really have a subjective hearing problem. Well, it turns out even for those patients treating the hearing loss, for our patients at Treble Health, gives them a lot of relief from the tinnitus. It can be a big part of their recovery.
Without question. I think that that's what we have available now, right? And that is absolutely a very important part of treating people now with the technology that we have available and the treatments that we have available. Wearing hearing aids, if you have more than a mild hearing loss, is a very effective aspect of evidence-based tinnitus treatment for sure.
Okay. Well, as your experience as an ENT physician, I wanted to touch quickly on, what are the common questions that patients have when they go into your clinic? There's a lot of patients who are listening to this who have been to an ENT doctor or an audiologist or a physician. And unfortunately, sometimes those conversations are full of despair or an abrupt, hey, sorry, there's nothing I can do for you. There's no cure. You just have to live with this. But we have right now an opportunity to rewrite that story and for you to speak to many patients here about the ENT doctor perspective on what could happen for tinnitus, what kind of hope is available. So what would you say are the main talking points you like to give to patients who are trying to make sense of what they should do with this hissing or ringing sound in their head?
Yeah. Yeah, I certainly understand what you're saying, and it is unfortunate that so many patients suffering with tinnitus have been told by their primary care doctor or oftentimes ear, nose, and throat specialist that there's nothing that can be done to treat their tinnitus. But in truth, there are a number of treatment strategies that have been shown in clinical research studies to reduce the severity of tinnitus. They're just not simple. They're just not quick fix solutions. And so they're not readily available to a person's primary care doctor. And some people may not be aware of what those treatment options are. But there certainly are treatment approaches. They're just not in the form of a pill or in the form of a quick fix procedure. And in the paradigm of our healthcare system here in the United States, that's kind of what people have come to expect when they go to their doctor with a health problem, that the solution is going to come in the form of a prescription for a pill or signing them up to have some sort of procedure to fix the problem. But in reality, that's not something that works for all health problems. And tinnitus is one of those problems that, for now anyway, there's not a pill that works great at alleviating tinnitus or a procedure that works great at alleviating tinnitus. But there are other approaches that can certainly be helpful. I know you offer many of these services at Treble Health, and there's a number of other places that offer these kinds of treatments. It's just a little bit more labor intensive, and it requires a little bit of time and effort to see meaningful results.
Let's jump into our first study today. And remember, we are going to talk about migraine tinnitus, then linear bimodal stimulation, and finally, internet-delivered tinnitus treatment. So let's jump into the migraine tinnitus link. This study, which was published in an ENT journal in 2025 here, very recently, it went to study and evaluate the efficacy of two drug combinations on tinnitus, measuring stress, depression, sleep, anxiety, and tinnitus response. So, Dr. Warden, could you explain the background of this migraine tinnitus link and what this research found with the drug interventions?
Yeah, so let me give you a little bit of background on this because a lot of people are kind of surprised when they hear doctors talking about migraine and tinnitus. Because I think the common conception out there is that migraine is a headache problem. But it turns out that migraine is much more complicated, and it's not just a headache problem. In fact, you can have a significant migraine disorder without having headaches at all. And I think as people have studied and learned more and more about migraine, they've come to realize that it is a complex neurologic condition that can manifest in a number of different ways. And it certainly can have a lot of different manifestations in relation to the ears. And so in an otolaryngology practice, we see a lot of patients every single day that come in to see us that have various ear manifestations of migraine. And that can include things like fluctuating hearing loss, unexplained earaches, feelings of pressure in the ears, and ringing in the ears. Both pulsatile tinnitus and non-pulsatile tinnitus are quite common in people that are suffering from migraine. And so the thought is that many people, not everybody, but many people that have certain forms of tinnitus may actually be experiencing tinnitus that is influenced by an underlying migraine disorder, even if they don't have a lot of headaches. Or maybe they had headaches when they were younger, but they went away, and now the migraine is manifesting in more atypical ways.
What comes
Yeah.
what comes first here, the tinnitus or the migraine?
Well, the thing about migraine is that people they're born with a genetic predisposition for migraine. So most people that have a migraine disorder likely have slightly dysfunctional ion channels in their neurons that predispose them to this condition. And under certain circumstances, when their brain activity crosses a particular threshold, then they develop migraine symptoms. And a person's migraine symptoms can actually evolve over the course of their life. They may have motion sensitivity when they're a child, or they may have abdominal symptoms when they're a child. And when they're a young adult, they might have more classic migraine headaches or headaches around their menstrual period. And then the headaches may go away, and then later on in life, they may have fluctuating tinnitus, or they may have episodic vertigo, and that may be the newer manifestation of migraine, even if they're not having headaches at all.
Yeah, in your practice, what did you see with your patients? Is this an underdiagnosed connection? And how common is it, do you think, of this migraine relationship with tinnitus?
Well, in my practice, I would say that somewhere between 30 to 50% of every patient that are of all the patients that come in to see me in the clinic have an undiagnosed or are not totally understood migraine disorder that is contributing to their symptoms. So it is very, very common in otolaryngology clinics. With regard to how many people with tinnitus have migraine, it's probably a pretty significant number. I'm not a person that thinks that everybody that has tinnitus has migraine that's causing their tinnitus, but there's definitely a subset of patients with tinnitus where it's pretty clear that migraine's playing a role. So those people that have fluctuating tinnitus, so not somebody that just has high frequency hearing loss and their tinnitus is the same all the time. Maybe it's a little bit louder when they're in a quiet room, but otherwise it's pretty constant. We're talking about somebody that says that their tinnitus fluctuates quite significantly over the course of a typical week. Or somebody that has reactive tinnitus, where they say that environmental sounds, even if they're not particularly loud, may make their tinnitus much more pronounced. And a lot of people that have somatic tinnitus, so people that can modulate their tinnitus by touching their face or moving their jaw. A lot of these folks likely have an atypical migraine disorder that is influencing their tinnitus. And it's not necessarily entirely responsible for the tinnitus, but migraine is probably what causes people to have these spikes in tinnitus, where their tinnitus gets a lot worse for several hours or a few days in response to being stressed, or in response to not sleeping well, or in response to hormonal fluctuations or a new medication that they're taking or something like that. It's very likely that migraine is responsible for those kinds of fluctuations. So if we can intervene and treat the coexisting migraine disorder, we can really cut down on those tinnitus spikes.
If you're listening right now and you're curious about this, comment below, curious about migraine. Dr. Warden, let's now jump into the statistics and the data. So what did this research study find on these two drugs in the experiment?
Yeah, so this was a research study, a randomized controlled trial. I think I have the paper right here. Ta-da! This was done by Dr. Jalilian, and he's at the University of California, Irvine. He's a very experienced clinician, ear surgeon, and he's done a lot of great work in the field of tinnitus. Anyway, this was a randomized controlled trial where they gave people either a placebo or a combination of two different migraine medicines. So nortriptyline and topiramate, or verapamil and paroxetine. And these are medicines that are commonly used to prevent migraine headaches. And then they estimated their tinnitus severity both before the study and then after taking these medicines. And the take-home point is that the medicines were effective at reducing the severity of tinnitus in many of the patients taking them. So 40% of the patients taking either of those drug combinations had a meaningful improvement in their tinnitus when compared with the placebo. And so this is just kind of a first step study. It probably didn't enroll enough patients in order to show a more meaningful difference when compared against a placebo, but it's a great first step. And I think it will likely be followed by other studies following this same theme of, if we treat migraine, how much improvement can we see in tinnitus? But I will say that migraine is kind of a tricky thing to treat, because for most individual people that are receiving therapy for migraine, they might need to try 2 or 3 different medicines before they actually find one that works. And oftentimes the treatment approach for migraine is kind of multifaceted. It's going to involve nutritional supplements and trigger avoidance strategies and things like that, which make it a little bit more complicated with regard to testing it in a clinical trial. But nonetheless, I think the study shows real promise, and I think that more and more people in the otolaryngology community will be convinced that this is an effective strategy for a certain subset of people that have tinnitus.
Definitely gets me excited to hear this. And I'm thinking in my head of the catalog of patients that I've had over the years who have very fluctuating tinnitus, but we couldn't exactly figure out why. Sometimes people have explained that it's related to these biorhythms in the body. It very well could be migraine, and that's something that we're going to study. I'm curious. It sounds to me that yes, tinnitus is its own, complex condition that is affected by things like the nervous system and the psychology. Migraine is its separate own complex system that's affected by different areas of the body. Okay, so people would want to know, is this a pill in the study? Are they taking an oral medication? And then any estimated timeline of when you think more research could prove this is safe and maybe be actually administered? Or are certain doctors administering this right now kind of off label?
Yeah. Oh, great question. So the treatment in this particular study, Dr. Jalilian's study, these were pills that people were taking. But if we have time, let me share another cool study that was published that's related to this subject. So there was a study published in 2021 by a group of migraine researchers that were using Botox injections as a treatment for migraine. And what they observed is that many of their patients were coming back after getting the Botox injections and saying, you know what, my headaches are better, but also my tinnitus is better after getting the Botox injections. And so they started looking at this in their population of patients getting Botox injections at their migraine clinic. And there were a couple of patients in their clinic that had complete resolution of their tinnitus after getting Botox injections in the head and face area for their migraines. One of their patients had had continuous tinnitus for more than 10 years, and one treatment of Botox made their tinnitus entirely go away. And they had another patient that experienced total resolution of their tinnitus with Botox, but it came back again when the Botox wore off in 3 or 4 months and their headaches started coming back again. Their tinnitus came back again also, but then when they got the Botox again, the tinnitus again went away. So that's a different form of migraine therapy. That's an injection, the Botox, but also that lends additional support to this theory that there's this connection between migraine and tinnitus, and that treating migraine can also make the tinnitus better.
All right, we're gonna monitor this closely and be giving updates here on the Treble Health channel, and we'll definitely have you back to discuss new research in this vein. But can this medication be administered today if someone asked their ENT doctor for it?
Yeah, absolutely. Now, I mean, I'll say that there's not an FDA indication for tinnitus for these medicines. So it would be considered off-label use if somebody didn't have migraine headaches and they just were receiving the medications for the treatment of tinnitus. If they meet diagnostic criteria for migraine, however, then it's smooth sailing. It's easy to get these kinds of prescriptions from a primary care physician, a neurologist, or an ear, nose, and throat specialist. So if somebody feels like they might be in this category, somebody that has fluctuating tinnitus, somebody that has reactive tinnitus, or somebody that has tinnitus along with unexplained ear pain, or tinnitus along with ear fullness, or tinnitus along with episodic vertigo, then by all means, migraine-specific therapies are something that they can discuss with their doctor, even right now.
Well, it's very helpful. And for a lot of people, when they hear that, I can just feel their nervous systems relax and they start to feel hopeful that this might be the piece that can get them relief. And that's and I want everyone listening to recognize that there are these types of approaches, whether it's certain sound therapy or potential medical intervention or certain types of counseling, right? There are these things that can provide you relief. It's so common that people think, I've tried everything, there's nothing I can do. But we're learning here in this conversation, there's probably a lot more that doctors like Dr. Warden and I understand about tinnitus that can be used for patients to get relief, probably a lot more than you realize. So definitely.
It's not hopeless. It's not hopeless. There's a lot we can offer.
Absolutely. All right, let's jump to our next study here, which is linear and bimodal stimulation. So this is a study that is referred to as the TENT-A3 study. The group Neuromod out of Ireland created this medical device called Linear, which is the one that goes in the tongue. Many people with tinnitus know it by that. And it has the tongue tip and also has the headphones. So this particular study was published in 2024. And Dr. Warden, what did we take away from this? Did it give us any new information on the efficacy or safety of this approach?
Yeah, so what was different about this study compared to the prior two studies on Linear is that this study actually had a control group. And so when we do a clinical research study, especially for something like tinnitus, which is a somewhat subjective health problem, it's really important to have a control group for comparison purposes, just to make sure that all of the improvement that people are reporting isn't just due to the placebo effect. So the first two trials for Linear did not include a real control group. And so this study, the TENT-A3 study, did contain a control group. It wasn't exactly a double-blind randomized controlled trial like we would ideally like to see, but there was a control group where each subject in the study served as their own control. So basically, this study enrolled patients, and for the first 6 weeks of the study, they just got the sound only component of the Linear device. And then after the first 6 weeks, then they got the full bimodal neuromodulation, where they got the tongue stimulation and the sound stimulation at the same time. And they measured the severity of tinnitus at the beginning of the study, after the first 6 weeks, and then after the completion of the study at 12 weeks. And they saw how the severity of tinnitus changed as measured by the tinnitus handicap inventory score. And they showed that there was a meaningful improvement in tinnitus in response to the bimodal neuromodulation. A surprisingly high percentage of patients actually noted meaningful improvements in their tinnitus just with the sound component without even getting the tongue stimulation. I think over 60% of patients found that their tinnitus improved meaningfully without the tongue stimulation at all. But an additional 40+% of patients saw added benefit when the tongue stimulation was added to the treatment regimen. And I think that overall, a high percentage of patients reported meaningful improvements in their tinnitus with the Linear device. But I do temper expectations when I talk to patients about Linear, because I don't feel like it is the cure for tinnitus that many people were hoping for. The amount of improvement that we're seeing in tinnitus severity as measured by tools like the tinnitus handicap inventory is on par with what we see from other studies for cognitive behavioral therapy or mindfulness-based interventions and stuff like that already exist. So it's not like bimodal neuromodulation is really outperforming the treatments that we already have for tinnitus. And it's important to also recognize that a significant percentage of people in this study, over 30%, actually reported a worsening of their tinnitus at some point during the study. And that's kind of hard to ignore.
It's definitely provided a new tool for clinicians, and for some patients, this is a more effective approach than what they've tried. So I like how this study went through a pretty logical path of someone's going to try some sound approaches on their own through some at-home tools like over-the-ear headphones or their, things like that. And then if they don't get better after a month or two, then they should consider a more professional treatment. And that's actually an overall good approach for most tinnitus patients is, hey, try some things on your own, self-manage this. If you're not getting better, or especially if you're getting worse, then consider working with a professional for a more formalized treatment.
Sure, absolutely. Absolutely.
Quickly, just a few minutes here to talk about internet-based tinnitus treatments. There was a study that tried to understand, hey, what if tinnitus intervention happens over the internet, over telehealth? So that was a 2024 study. And what did they find, Dr. Warden?
Well, I think what we're dealing with here with tinnitus in the United States is that tinnitus treatment that is effective exists, but we're not doing a very good job of connecting people with effective tinnitus treatments. And that's because in many geographic areas, these programs aren't available. And for many people, they're costly because they're not always covered by insurance. So it's becoming increasingly clear that one way of overcoming those problems is by delivering evidence-based tinnitus treatment using the internet or using an app, because that can be more affordable, it can be more convenient, it can be less time consuming, and it is accessible to anybody that has an internet connection. So not surprisingly, a lot of people with tinnitus are skeptical, though. Can I really get effective tinnitus treatment over the internet or using an app on my smartphone? And that totally makes sense. It makes sense to be skeptical, but there is actually a body of research that has looked at that very question. And the study that we're talking about today was a meta-analysis and a systematic review done by researchers from the University of Trieste in Italy and the University of California, Irvine. And they looked at 14 different clinical studies, 9 of which were randomized controlled trials, looking at different internet-based therapies for tinnitus. And they compiled all of this data, and then they reviewed the results again in aggregate. And what they were able to demonstrate is that on average, these internet-based therapies, regardless of whether they were using cognitive behavioral therapy or sound therapy or acceptance commitment therapy, on average, they were seeing improvements in the tinnitus handicap inventory of 18 points and the tinnitus functional index almost 25 points. So those are actually really meaningful improvements in tinnitus that are as good, if not better, than a lot of the other tinnitus treatments that are marketed out there, like in-person cognitive behavioral therapy, or even devices like the bimodal neuromodulation devices like Lanier, or the device that's been developed by Dr. Susan Shore's team at the University of Michigan. These numbers are just as good as those numbers with regard to the amount of improvement in tinnitus severity that we're seeing. So I think that these internet-based therapies are a great option for a lot of people with tinnitus that live in an area where there's not nearby tinnitus clinics that really specialize in the treatment of tinnitus.
Evidence-based treatment, that's what people want, and this study is mentioning just that. We're going to wrap up here. Dr. Warden, you've been a great guest. We're going to have you back. Guys, my name is Dr. Ben Thompson with Treble Health. We provide an internet-based telehealth service for counseling as well as for devices for tinnitus. Dr. Warden, how can folks connect with you, and what do you have to offer in terms of internet-based tinnitus solutions?
Yeah, well, I work to develop internet-based therapies myself, and I have a program that we're optimizing that's called Alleviate Tinnitus Therapy. And people can find me at www.alleviatetinnitusTherapy.com or send me an email at info@alleviatetinnitusTherapy.com if they have questions about our offering.
Excellent. Guys, thank you so much. The Tinnitus Relief Podcast will be back with another episode, and we'll see you there.